Sound number.
Good evening to you all. As of all,
Yeah, honey.
What about what's the sound remember?
Once in a while. Oh, okay. Okay. Okay.
And wait for them to introduce us.
Okay. All right.
as of all, I didn't come by. Your mom financial say. Ready? All right. Also for any line so. I just want to find out that Dr. Daniel Usu is ready so that we pray and start. Doctor, can you respond?
Yes, I'm here.
All right. And
Hello.
okay. Then we'll pray. Then we'll start. The best friend.
All right, sure.
As one point, boy do. As one point, you think say we bomb pen. I change my diasi. So boy, you think can. Okay, one thing can. But you mom pay. You didn't afford it. Come afford. You didn't papa yes. That was something out of pro. I change. You did you mediation on sa. You know, on sa. In DBL here and fan come no for doom. Na ya yɛtie so yɛntie gu akoma pa so ne ntu ho anamɔ na yɛasekyerɛ mu ne apɔmuden mu ntu mpɔn mu atumi asiesie ho ama na opie atumi aka mu apa no bi agye yɛhyɛ ase bɛka ho na ewia de ayɛyi ne nkamfo ne tontom kɛseɛ mmɔden yɛda wase sɛ danda wotie na nnwuma nso atie ɛsiane sɛ yɛasoro nyina mu nti amen. All right, Doc, you can take over. Thank you.
All right. Mima Obiajo. And me pese me do biase say ene numeri kwan abedem say ye be kasa fa ya pomden ho timide aseda kese ma mu nyina say monyamre and for the audience last week ye sha say ye kasa fa erectile dysfunction ho ye kakra ehun kwan a yɛde nkan hyɛ aseɛ wɔ kwan a yɛ bɛrima no yɛakɔyɛ mmemme kwan yɛfa so sɔre a pagya ama emu yɛ den ana yɛhu kwan a sɛ nneɛma bi ɛba yɛ ne bebree mu a ɛbɛyɛ akwansideɛ a ɛma yɛsan so ɛma causes detailed causes ɛwɔ nneɛma bi etimi si a bɛrima no ntumi nsɔre yɛka nso sɛ sɛ ɔbaa ne bɛrima ɛkɔ ntɛmu no usually no there is no standard for sex It depended on your partner, whatever that satisfies you are any problems your health, then it means say I'm queer, not just say what problem, but say queer mama, not just say it's not a problem, irrespective of the time. And yes, I something say many go yeah, and yen pine soon. I have friend psychosexual disorders. Obi wɔ answer only or barbedam, yen bi wɔ or pese or decam, I know medically no. Do na na yare nketinketi a ɛhyɛ yɛn ho a ɛtumi ma ɛda deɛ ɛwɔ saa kwan so. Nti yɛhu sɛ causes of erectile dysfunction no ebi yɛ nnuro a yɛfa sɛ wɔ BP, wɔ diabetes, wɔ yare bi a wofa aduro ɛno no nso tumi ma how you be a besua so. A beans no say what psychological problem. Yet one drain quite fast a drain no it be an ACP and no so to make of fast I already back. And no beans or have no acquire surgery a fat made prostate home and also it's lima erectile dysfunction need to be also. Even obinso or kidney failure, obinso or metabolic conditions like diabetes and hypertension, and also yeah, they are a bit me offer erectile dysfunction maybe abroad. So, and it sounds some risk factors. And also it's me a predisposal to erectile dysfunction. A business unfien a koneni. We are brand here, quite a so any of Benyan Kita in Kitamdi one people. Ayana strong come from say no and you bit says smoking any insanum alcoholism and also tinima erectile dysfunction ibiba. You have one man be brave so maybe a copy a treatment of erectile dysfunction. Say ya really bow so kwanya is so asa yare no na ekoye ekudu ho a see last week na answer metwa so no me pese it be from last week experience no obi wo asimbuse bia o pese on the recap that of last week no e bia mema akwenya nkofo miensa wo question bia we busa answer ya to a so. It's my stress will do a question be or betting or person busa if I last week or betting busa and sign up to treatment so and there.
So for it was if I'm say it's open now. Now I'm say last week now questions will be by and also for can a doctor can say can on to us. It is open now. Say last week, your questions we will have it in media bar, and so I'll call the next topic. So we are giving us just 2 minutes. I'm say Breno, and say just 2 minutes. We'll be all questions behind it media bar now. So for answer now, and so to us by. Yes. Yes, when you are at Deb Watson, yes. Please, you can talk.
So, Pastor Madas. Pastor, last week, not the person me busa, a doctor ni take on the issue of anal sex, oral sex as a part of our life in marriages. I want me or educate, but say be normal and I say BB and how should we really view some of these things from a medical point of view?
Okay. Any other question? Nanka, at least 2 or 3 Nanka or something in upper mind. Any other question?
All right. So that's the first question.
Okay. Okay, I'm so let me I go ahead. So please go ahead.
Okay, now who say I die what saying person who's a question? Is it the same person just asked?
Yes, the same person. Thank
you. All right. So from medical point of view, anal sex imposes some level of dangers. It's usually, it becomes a bit of a problem for some purpose.
What even can we position kakra? We can't hear you at all. Dog, network them say which me a position kakra my. And I'm fan chain, I'm saying the network no I am very bad. The some fan chain I'm say dog. But we're seeing connecting, we're seeing back. Okay, I think he's back. Look, can you hear me now? Hello, dog. David. Hello, dog.
Yes.
So, the network no more. Some fan chain, I'm saying we'll resolve it very soon. Look, can you hear? Remember, some few minutes here. We'll get back to you.
Hello.
Back. Thank God. So you can go ahead, please.
Yeah. Hello.
Yeah, we can hear you very well. Dog, you're talking, but we can't hear you from here.
You can hear me?
Yes, we can hear you now. Yes.
Okay. Is it? All right. Anal area is highly used, highly blood vessel by blood because of the lots of blood vessels are a war anal area. And to add to it, there is also an anal sphincter that closes and opens to allow feces. So continuous sex in the anal area can distort, maybe say the sphincter, as well as destroy some of the blood vessels. In baby, now you can't control your anus in terms of passing stools and answer uja nine. So we don't advise anal sex. And for oral sex, and also no, all these unnatural areas of having sex predisposes you to infections. And this is such that infections, some parts of the body will do it better than the other parts because it is meant for sex. When you have an STI and it's around the genital area, yes, and we know we can easily identify and treat. But when you have cross-contamination from the genitals to any other parts of the body, it can't be easily detected and treated on time, which can also lead to a lot of complications. So usually, we always preach practicing safe sex and something your body can tolerate. But for anal sex and oral sex, the level of transmission of infections as well as every organ in the body has something we call epithelial tissues, and every epithelial tissues are designed for anal area. That reason through the vaginal sex. Patrick, you bit me at us.
Yes. Oh, go ahead. I'm saying, but I think you can go ahead. I'm saying network no more in the prayer. Yes, go ahead.
So we continue.
Yes, let's continue.
All right. So let's come treatment for dysfunction.
So can you try this? Maybe
medication.
Okay. So I don't know whether you can
sound near bad.
Yes, very bad. Maybe so wait me on me to the video and then maybe the voice, maybe it will help.
Okay.
Yes. No, we can hear you, so go ahead, please.
Okay, all right, that's fine. So yes, so based on the causes, we can easily identify the treatment. Number one, let's start from medications. Obi wo hɔ na wakɔ hospital ne aka kyerɛ ne sɛ wɔ BP anaasɛ or diabetes ne ama no eduro anaasɛ aka sɛ wɔ depression ne ama wo antidepressants. Some of these medications can cause erectile dysfunction. So usually we say that sɛ ɛma wo eduro wɔ hospital,
That is why it is also not good to do self-medication, because you might be taking a drug for all you might not be aware of. So we advise against self-medication, especially when you have taken the medication for some time, still you are not getting better. So some drugs can cause erectile dysfunction, and once you notice say you have been introduced to a new, you go back to your physician or your caregiver, then they will ascertain if it's that particular drug. Now your indro no ama or fa idro ohun say ne mema yo kofom no on call back to the hospital or no if we need pemu na ojai indro nifa. We don't advise that. And no, for most of the medications, they are replacements. Into ba, you bet me a change assessa a drona mouth. I be mouth fufra, a bejawa, a emma, or mema yon encoform. In droning be also a combinations. Into bet me a mouth draw, ede ubi pino eba form. Na a sound so ACC or mema yono. Yes, so that has to do with the medications aspect. And ubi so na or psychological issues. So once you have psychological issues, then it means, as I say, identify the exact problem you have and deal with it appropriately. When we are able to do that and you get proper counseling, you see a clinical psychologist, you can come out of this situation. And like last week, me can any partner, so there is no peaceful relationship between them. And also definitely your sexual function will go drastically down. Sorry, so for now I hear counseling kakrama, where we have to take actions, we do, then you come out of it. Then we also have underlying medical conditions. Maybe you have diabetes, maybe you have hypertension, maybe you have some form of depression, some neurological problems. And also, whenever that problem is taken care of, it means you get back to your normal sexual function. And no. Say be our sugar no na me managing here. Oko hospital, you better check your sugar no near managing here amount. And also banesa. So sugar no levels no ebe normal for a long period of time, you can regain your sexual function. And the same thing for any other disease condition. Ama we're regaining or sexual function. So these are some of the things we can do in terms of the causes to mitigate erectile dysfunction. And some kidney problems. Sometimes kidney problems and so it's mima umema yoneko form. And a kidney also, like we always say, kidneys me say even up to 90% are still onya signs and symptoms of kidneys ne say. Just say I say it which answer when you nkaibo say I did not say. Into brown no yes say as I say ye two anamonko ayarisabia. Now you share the health of our kidneys and our liver, as well as cholesterol. Because cholesterol so cholesterol it's me ACC intinima erectile dysfunction into me also. Inti we brown no hospital near Shresanya Manimawa. Na ye say yet na say the draw kanwa and I see a tool for in a particular lifestyle changer and no so timima a hunto eba. But quite apart from that, based on the kind of dysfunction you are experiencing, there were other techniques. Yetimi use the bois. There were techniques with Master and Johnson technique. I know some form of exercise. I bet sure to strengthen your pelvic floor and the muscles around that area. I know so bois ama abakakra. And usually we say that exercise particularly is very, very, very effective. So they manage erectile dysfunction. Because we say that at least once about 30 minutes in a day, as I said, nipibiano, utmiye exercise. And whenever me cassava exercise one, I am quick to add that can't me say doc ebia mejuma na me no me factory hand and I say be me ton me the nyema si me so ko echi na che say and also exercise. No, exercise is always targeted. Exercise, no, oh yeah, you do it with an aim and with a target. And once those things are not there, then you are not exercising. You need proper exercise at least. And for this kind of condition, you know, usually the aerobics we do are very, very effective in managing the erectile dysfunction. You see, sometimes I'm sorry, you call walk, we are near aerobics. Yes, these things help a lot in managing erectile dysfunction. So exercise is very important, and lifestyle changes, sedentary lifestyle. You move we take too much of fatty foods, we take too much of meats. All these things are not good for our sexual function, and especially those of us who like taking fizzy and carbonated drinks, because with time it means your blood is going to go up, and once your blood shoots up, you are going to suffer from erectile dysfunction. And see, we preach against fizzy drinks and carbonated drinks. So age no anymore. As I say, avoid it. Once you're able to do that, you are on a path to good sexual health. Apart from that, yes, also some topical medications we can use depending on what exactly is wrong with you. Your genital area, and you can have some relief. There's also injections, injectables. It's injected to give you some level of erection. And also Uber hospital. Yes, also surgical procedures. UC. The correct erectile dysfunction. Ebiana unya trauma, unya problem via affect the design of your sexual organs, and also yetimi yes surgery to correct those things. All these things are mechanical. I'm stressing on them because most of us think the only way to recovery medicines. No, we have a lot of procedures UC cure erectile dysfunction. So it is not advisable say fear free pain no Fordjour now the akoka because in only be side effects no ebia na BP or diabetes or yare bi adro no koka ho ebe ma yare no ayekese. So we don't advise self-medication. And yes, also alternative medicines, your herbal and alternative medicines are so you can employ in management of erectile dysfunction. Usually we preach that for a lot of fruits and vegetables that contain antioxidants, when you take the colored vegetables and fruits, most of them have antioxidant effects. And these antioxidants no ever mop up free radicals, the anti-aging, into body no, and now say infections about nipple anymore. Sometimes when we release free radicals, and say so na say we did DMN at the and also unya a lot of free radicals in your body. And all these things are not good for your sexual function. They are not good for your say untinimuno ahudeno. Yes, na akoform na intinima kosisi na akofa erectile dysfunction abroad. Inti yep. Preach say more fruits and vegetables you add to your diet, and when you're able to do that, you have a good sexual function. And we also know that some fruits are also good for sexual function. A lot of fruits are good for sexual function. I wouldn't want to mention some because I know if I mention some, a lot of questions will come. So maybe it would be our problem. No, the person can call me and will have a session on some of these things. So some fruits are also very good for enhancing erectile dysfunction. Yes. So these are some of the things we can do when we want to come out of erectile dysfunction. But senior media in these are purely doctor-patient issues. Because a lot of people have done that, and in the long term, it has given them no erection at all. So anytime you experience erectile dysfunction, the first thing you do is to consult your physician. Now you know the exact cause of your erectile dysfunction. If you don't need medicines, then we can tackle it as such. If you need surgery, if you just have to modify your diet. If even your sleep pattern. And no also to me problems, a lot of issues, So it depends on what you go and tell your caregiver or your physician. Then we can fashion out a treatment procedure that will meet you at the point you are suffering from your erectile dysfunction. And let me also add that whenever you suffer from such conditions, the worst thing you can do is to discuss with your friend. Because once you discuss with your friend, if you are not no afedro bi aboa no wa chew no akofa bi. No. Se bi se ekọ tailor ho akọpa me atare a o be add in the measurements ko and se apama ma no. Yes. So in the same vein, anytime you think your sexual function has diminished, the best thing to do is to go to the hospital, get yourself examined. And through examination, a proper treatment method can be given to you. And the bonus answer, you are treated completely and you never go back to the disease again. So these are some of the treatment modalities I have. So I'll end it here. We'll be further questions and our suggestions we welcome them. And I think that will be it for today.
All right, Doc, it was very MZ is open again. MZ na and we are now because hands with an MZ nanka. I'm sure that most of our questions will come from there. The first
yeah, I know.
You wait, and I'm sure the questions will come there. You answer them for us.
All right, that's it.
Let me show. And then I'm saying network in Tiama, Eddie. But what you can
Yo, doctor, and I was a party. By fruits now, okay, so only the other will at least Bobby 10.
The fruit the idea and your body.
Vegetables, one Omunti baby na Omunya Pitone no.
All right. Me know yeah drink. So research has shown that certain fruits are good, especially watermelon. And watermelon has proven to be very good. Initially, I didn't want to mention it because some of us not just is a panacea to our problems. So I did a hospital not artificial. But fruits like watermelon, very good for our sexual health. Tomatoes is also very good for sexual health. And banana has also proven to be very good, together with plantain. They are very good for sexual health. So there are more, but for now, I think I'll be willing to give about just these three. If you want more in a good combination, I'm always available when you call. I will take you through, and we have a good dietitian who will also take you through some of these things. So banana, watermelon, tomatoes, they are all good and they enhance erectile activities. Yes. So these are some of the few I can mention for now. Maybe in subsequent sessions we'll do that. We'll do more.
And now maybe seeds and nuts. Maybe seeds and nuts.
Okay, seeds and nuts, no? Yes, some of them have empirical use. And they are in Habine, in Yanhine, but they have empirical use. But the issue is that most of them are for sperm production. Most of them enhance or maybe to say attach, for instance. You know, it is good. Maybe it's it is good, but these ones are useful for semen production. In hospital, the sperm count was low. Empirical evidence supports say it may enhance or sperm count. So if you have issues of infertility, they help. But in the long run, if you want them to help you for erection, but when it comes to sperm production, some of them are very good for sperm production, but not as good as we would want for erection. Yes, indeed, they are good, but for sperm production. So we should differentiate the two. Also, I hope say my answer to some extent.
That's it.
Doc,
All right,
maybe sir, a follow-up question to you. Couple of weeks ago, you answer fruits and vegetables now. And more somehow the kind of relationship to the body part and our organ. The resolve into a ginger and the shape no, it's like stomach. Or here carrot it is say a knee, tomatoes, it is say a knee. Maybe that's a enuntiana or can say banana and also no. Banana and also no, it is a erectile dysfunction.
Okay, yes, what you are saying is excellent. Your friend doctrine of so with the doctrine of signatures, during drug development, they were trying some of the plants to know what they were for. And one of the things that led them to discover some of the useful medicines we have is doctrine of signatures. The shape of the plant or fruit or whatsoever it is, or they compare human body now, which organ are essay, then you can make claims. Yes, and it worked. Along the line, it worked. And banana, because banana gives a lot of energy. Banana gives a lot of energy and contains a lot of vitamin K. So for that reason, it's useful. But if you want to use doctrine of signatures, yes, and also could be a reason why it contains energy and it contains a lot of vitamin K and can be useful. Yes. So yeah, that doctrine still exists. People still use it.
Now, another follow-up, memane die medasupani chechemu. Memane die if the man is operational sexually, then the operational still now there's a dysfunction somewhere. And, when you say you've concentrated more on the men,
the men.
What about our wives or spouses?
Yes, I'm also experiencing some some sort of deficiencies with sex. But the only difference is a woman doesn't need erection for sex, and a man needs erection for sex. But when it comes to overall sexual health, yes, some of the women also have issues. One of the issues is frigidity. Even when you're having sex with them, they are not properly stimulated. That is purely a medical condition we can deal with. Before you are able to penetrate the woman, as I say, unya some vaginal fluids to wet the vaginal opening for the penis to be able to enter. That mechanism is lacking. Or wet, wet in term, and also cause pain. So they wouldn't enjoy the sex. We call it dyspareunia. So man also issues. And also it's me, Emma, affect sexual function overall. Yes. But just the difference is that a man will need an erection to have sex, basically, but a woman wouldn't need an erection. So whichever way the sex will happen, but there might be issues with her. Yes. It's very true. So the women also suffer some level of sexual dysfunction, not necessarily erectile dysfunction. Some of the women also undergo genital mutilation, like we know, after they enjoy. Yes. So yes, it's true. The women also experience.
Correct. Look, I'm saying, my question is, see, I watch watermelon, tomatoes, banana, plantain. Plantain, I don't know.
And the annual.
Banana, a week.
The annual, the auto.
Okay. I don't know. So in a week, no, banana, like, I don't know, say in a week, a day, and maybe a week.
I think I know that I will have to speak to a dietitian. I might only speculate.
Oh, okay.
And I think a dietitian will be better to answer. I might only speculate because usually we advise 4 fingers.
Oh, okay.
Especially for people who have peptic ulcer. But OBB said diabetes is advisable because it can immediately increase your sugar.
Okay.
Unless you are in crisis and your sugar levels has dropped low, and you're with me afa. But for diabetics, we don't advise the intake of banana. As much as we are saying this, say also medical status.
Okay.
Then we can advise appropriately.
All right. My next question is, in a week, how many how many times you are going to? How many times do you recommend sex to take place? Maybe a week. How many times? Can you tell us something about it?
And yeah, there's no standards. There's no limits. But like we said last week, for everything you do in moderation. For everything you do in moderation. Because as much as sex is nice and it's pleasant and it's gives a lot of relief, too much of it can also disrupt your normal everyday activity. Because like we said last week, whenever you're having sex, it means you are depriving your body so much. You are depriving your body of so much blood to pump them into your sexual function, your penis to have an erection. So you wouldn't want to overindulge. You wouldn't want to overindulge. You just stop. You listen to your body. So still no good. So then you are hurting yourself. So with time, you bring a lot of issues to your heart health as well as your thinking ability. So as much as you do it in moderation. But for standards, we wouldn't say. But one thing we'll add is anymore, and then you slow down a bit. When your age is advancing, then you slow down. It's over can be an hour to see an hour and no boy. Because we said more often than not, the men die early. Life expectancy in Ghana for men is 62, for women is 64.
Okay.
So we don't know if we can also count.
All right, thank you.
Yeah.
We have 8 minutes more. Any other questions? Also for Doc, I'm saying that minimum say Doc also for no kind we wanted. I don't know whether the 8 minutes can just give about prostate.
Prostate. Okay, that's fine.
Okay, just some few.
So I'll just give an overview of what the prostate is.
Okay.
Okay, so prostate. The prostate is an organ, is a gland, is a mass, it has muscles and is a gland. Beneath your bladder, organ that is only found in men. So it is a gland found beneath ojunso or bladder no, wrapped around your urethra, the ojunso no, efemu epie no. Yeah, so that is where the prostate is located, and the prostate is there to, number one, produce the prostatic fluid. Se bema ne ɔbaa hyia nsuo na epie ma wodi w'ani ho sɛ nsuo na epie no, ɛno no saa alkaline fluid no prostate ne na ɛyɛ. And also the prostate helps men to enjoy sex, because when you are ejaculating, prostate ne pompe Emma unya that kind of excitement. Yes, and the prostate also produces some hormones that also makes you a man. Nti prostate no ɛyɛ ade a ɛho hia mmarima yie. Na ade baako a ɛkɔma prostate no yɛ hu paa ne sɛ the location of the prostate. The location of the prostate makes it dangerous to the health of men. Esiane sɛ the prostate is located just beneath your bladder, around your urethra. So any problem prostate nim no, it means say ojonsosem no ɛho bɛka. And that is why the prostate is so much important to talk about. Intina akoye adia say yɛka ho asɛm. Because in men, apart from skin cancer, prostate cancer kills a lot. You know, in men, apart from skin cancer, prostate cancer kills a lot. Just like in women, apart from skin cancer, breast cancer also kills them. Yes. So the location of the prostate makes it an important organ to the man. And also functions of the prostate in terms of reproduction and in terms of sexual health also adds up to the importance of the prostate to men. Now, prostate na ɛyɛ ketewa, nanso yare bebree timi bɛm, yare ahodoɔ bebree timi bɛm. Nti categorically no, yɛde yare bɛyɛ mmiɛnsa bata prostate ne ho. Number one, your prostatitis, ɛno yɛ infection about prostate na ayɛ inflamed ahono say bibi abɔ wɔ honam ne pagya that is prostatitis. Number two, your BPH ɛno no yɛ benign prostate hypertrophy, prostate hyperplasia. ɛno no nso yɛ sɛ bɛrima bia wonyini a na o prostate ne nso ɛyɛ kɛseɛ. But ebi deɛ ɛyɛ kɛseɛ boro so. It means that cells no ɛyɛ kɛseɛ, ebi nso divide ntɛntɛm ɛma no yɛ kɛseɛ ɛno no nso yɛ yare a ebetumi affect o prostate no yɛfrɛ no BPH. And the third one is prostate cancer. Now the difference between BPH any prostate cancer, they say yes. You spread. And they say prostate na na prostate cells need be spread to other organs, especially the bones and the muscles and the spine. Then you know that there is prostate cancer. But by examination, adebakwa a differentiating BPH, benign prostate hyperplasia, from prostate cancer. So or prostate no na and I say a yekas here from outside. But unya prostate cancer or prostate no a yekas here from inside. It means it grows towards the inside, and BPH usually grows towards the outside. So unya ka a bit me esi ujunso chano immediately, then the urine is not able to flow again. Sounds na unya BPH so it knows bit me esi ujunso chano drobeno and also bema Johnson no esi a intimi inflow just say the catheter and as a rubber eshe ubemanim answer with me at Johnson. So now we have identified what the prostate is, the functions of the prostate, and the three major conditions that are affected prostate now. I think next week, say your time and as any other time, we'll go deeper into some of the prostatitis, the BPH, and the prostate cancer. Then we discuss them appropriately. And for now, I think we have to know prostate, the functions, conditions that affect the prostate, given the time we have. I hope na another time you back domusuko na ya church and sim.
Right, Doc. God bless you. I'm saying
God bless you.
Question be any order. It you made any baby. What's are you online?
Patrai Moha.
Oh, okay. That means Pastor keep us also.
Yo.
Oh, okay.
Doctor, it was a party. As soon as next week, you started Adventist Men's Week. Adventist Men's Week. Yeah, chassis. Book of the year, no. Said they can one. Chapter 1, chapter 2, chapter 3, no. Infinity, no. You said the Akano. The for bar na at once. Afi, Yanjis Kakakra, ya de Bakwakoba, I tepa. The mediano. Na me aduma. Dear Chan, a more meeting in communal labor. Na muhu se edi yanso yawo ho na yeboa community nso edamu nyina ase onyame enkamo ja ko de sustain bi ho no bayo asembi and hodia edamase onyame hwe yenso doctor ko do asembi ho a
but also be any man am say no I better doctors you boy next week no
and yama ya anyemadu yama akwaba abetie mema wasam kakra the fitness week be ka general one bi no so ati why
I'm saying at I do mom say or buy no tico. I'm so already there. Okay. Okay. I want to I need numbers. Okay.
Yama pai. Nyame oni yɛtete boafo oni yɛ dida so ona yɛwre hye wo mu baabi a yɛduro yɛ na yɛre mebre ha mema na baako yɛ yidiane aka ho asɛm afei deɛ sa ha dwen kraa mponi prostate ɛsa ha yɛ yɛgye ho nyinaa hyɛ wo nsa ma yɛhoɔden betumi adi wo nsɛm so ne ahwɛ yɛkɔ yɛ no nso yi doctor nso hyɛ wo nsa yɛda wase sɛ wanya ho na afei ɔno nso bɛkyerɛkyerɛ ne ndie sɛ bi yɛn nyinaa de ho ɛhyɛ wo nsa another bi hwɛ yɛn so yɛn ne yɛyare ma yɛyaresa wɔadom ntra yɛn so na wɔnom nyam yɛ kyidom ne hyira yɛn ɛwɔ Yesu din mu amen.
Amen. I'm in see. I'm sure. Bye bye.
Eja tewia.
So,
Let's say we have a code.
Crystal Doko call so.
Eda was say. Dr. Dairo also Fordjour. And Doctor, if you hold.
I'm saying the network and I'm one of
Okay. And Samata, and so Eda was say. Afi, any about soon in a mahu at the airport, and then you may do. Eda was say, and Afi. Frimpong, nso no abusua eda mu nyinaa ase. Onyame nhyirae, ɛyɛ nyame pa dasɛnɛ. Yɛn kasa advertisement with you yɛbɛyɛ. Anya fi kura bɛka advertisement ho asɛm. Nyame nhyirae, nyame hwɛ yɛn so. Ɔma yɛn na yɛ o.
Bye bye.
Bye bye.